Good evening, everyone. This is Dr. Sanjay Solanke from Maharashtra, India. And here we have Tikva from Israel, co-founder of Homeopathy for Humanity. And we have Iona. Iona
Yep.
from Croatia.
Yeah, that's right.
Right. And over to you, Tikva. So what we are doing today, you can just give a little more, little brief about the topic.
Well, we're just continuing with our Organon step by step, and we are up to Aphorism 40.
Yeah. Who reminds certain things? Because Aphorism 40 begins with point number 3.
Yes.
The question is, what are point number 2 and what is 1? Do anyone remember?
If I recall well, he talks about 2 diseases being present in the body.
Exactly. Exactly.
Number Aphorism 36 is 2 dissimilar diseases meeting together. 37 is about ordinary medical treatment. 38 is new dissimilar diseases where one is stronger. And then last week's, or this week's actually, because it was Monday, 39 is about the suspension of the current disease by a new dissimilar disease.
Yes.
Yeah. He's talking about two dissimilar diseases meeting together in one individual or same individual.
Yeah.
What happens when the new disease is weaker, when new disease is stronger? Similarly, now we are on the third point in Aphorism 40. He's talking about, who will continue? It was?
If Ivana, you want to bring up the PDF, please?
Yeah, sure. Just a second. There we go.
Okay, so this is our third example. Or the new disease, after having long acted on the organism, at length joins the old one that is dissimilar to it and forms with it a complex disease, so that each of them occupies a particular locality in the organism, namely the organs particularly adapted for it, and as it were, only the place specially belonging to it, while it leaves the rest to the other disease that is dissimilar to it. Thus, a syphilitic patient may become sporic and vice versa. As
Yep.
2 diseases dissimilar to each other cannot remove or cure each other. At first, the venereal symptoms are kept at abeyance and suspended when the sporic eruption begins to appear. In course of time, however, as the syphilis is at least as strong as the spora, the 2 join together. 1, there's the footnote, that is, each involves those parts of the organism only which they are adapted for, and the patient is thereby rendered more diseased and more difficult to cure. When 2 dissimilar acute infectious diseases meet, as for example, smallpox and measles, the one usually suspends the other, as we had seen before. Yet there have also been severe epidemics of this kind, where in rare cases, two dissimilar acute diseases occur simultaneously in one and the same body and for a short time combined, as it were, with each other. During an epidemic in which smallpox and measles were prevalent at the same time, among 300 cases, in which these diseases avoided or suspended one another, and measles attacked patients 20 days after the smallpox broke out. The smallpox, however, from 17 to 18 days after the appearance of the measles, so that the first disease had previously completed its regular course. There was yet one single case in which P. Russell, footnote 2, met with both these dissimilar diseases in one person at the same time. Rainey, in footnote 3, witnessed the simultaneous occurrence of smallpox and measles in two girls. J. Maurice, footnote 4, in his whole practice only observed two such cases. Similar cases are to be found in Etmüller's 5 work, footnote 5. Pox went on its course undisturbed during a mercurial treatment for syphilis, as Jenner saw. Now we come to something important that Hahnemann says. From careful experiments and cures of complex diseases of these kinds, I am now firmly convinced that no real amalgamation of the two takes place, but that in such cases, the one exists in the organism beside the other. Each in pairs that are adapted for it, and their cure will be completely effected by a judicious alternation of the best mercurial preparation with the remedies specific for the spora, each given in the most suitable dose and form. And this is actually what we're talking about currently in the chronic diseases, isn't it?
True.
Yet when we have somebody that has syphilis at the same time that they have spora, and how to proceed with treatment. Treat the spora, then treat the syphilis, then go back to the spora, and then go back through that cycle again as needed until the person's well. So Hahnemann's saying that there can be, but it's rare, two diseases in the body at the same time when it's an acute, but when it's a chronic, people can definitely be affected by spora and then be infected with venereal disease, where we have to treat both.
And very interesting, Hahnemann wrote in chronic diseases about this complex miasmatic disease. When he tried to classify his categorize spora, 85% of all the diseases, near about 85%.
Yeah.
So, and 15%, in 15%, he divides venereal diseases. He divides 2 venereal diseases together in a person. And third category in 15% is, and he said it is very rare when 2 venereal diseases are mixed with SORA.
Okay.
But it
So
never
this is a very, very rare situation when they are coming together in the chronic state.
But they don't actually mix. They occupy their own place.
Yeah, right.
Yeah, I was surprised he doesn't mention psychosis.
He does in the chronic diseases in the next
yeah.
page. So tomorrow
Okay.
in the chronic diseases, we get to read about that. So
Great.
he's talking about how dissimilar diseases have their own seat of disease. And you
Yeah.
remember that when we're looking at case taking, we often are looking at where's the seat of disease.
Yeah,
Because that
location.
right location helps us find, you know, we can exclude a large portion of medicines often, depending on where the location of the seat of disease is, because there is more effect with certain medications on certain parts of the body.
Mm.
So
Okay.
it can be something that we can use as, you know, a quantitative or qualitative exclusion to weed out some of our case taking, but not
Yes.
all, because some of our medicines have very, very good showing throughout all aspects of the body, especially
Yeah.
with
So-called polycrests, right?
yeah, antisporics tend to touch just about every aspect of the body, but to a more or lesser degree. For example, you know, graphites is more of a medicine for skin than it is for kidneys.
Mm. Okay.
So complex miasmic diseases can exist in the body, which makes the person more sick and more difficult to cure. Each of these
Okay.
dissimilar diseases may have their own location or seat of disease. This creates a complex disease state of dissimilar diseases existing in the body at the same time. The cure of
Yeah.
such diseases requires different medicines for each state, which generally shows one after the other. And then, of course, we know from the chronic diseases that Hahnemann gives us the rules for what to treat first. But basically, you know, the presenting situation is what people commonly go with.
Yeah.
When people have spora and they have syphilis, you know, we usually treat the spora first. Hahnemann often recommends using heifer salt in the beginning of treatment, then using mercurius, and then going to the most indicated remedy.
Okay.
But then he reiterates again, we'll just go through this again there. From careful experiments and cures of complex diseases of this kind, I am now firmly convinced that no real amalgamation. What does the word amalgamation mean?
Like mixing together, becoming one.
Right. That's what we do with metals, right?
Yeah.
We melt metals together to make a different metal. So let's say we're going to make some gold jewelry. Maybe we're going to put some copper in that. So it's not going to be 24 karat gold, but it may be 18 karat gold, but it'll still have that nice yellow. That's an amalgamation, a mixture. Okay, so no real mixture takes place, but that in such cases, the one exists in the organism beside the other, each in the places, the pairs that are adapted for it, and their cure will be completely affected by a judicious alternation of the best mercurial preparation and the remedies specific to the spora, each given in the most suitable dose and form. So
You
they
were,
don't really join up.
but what you were saying now was from chronic diseases, right?
No, this is from Aphorism 40. It's just the end. I just replaced it at the end again.
Oh, sorry.
It's just at the
Okay.
bottom of the PDF.
Yeah, I can see it. I can see it.
Okay.
Okay. Yeah.
Okay.
Okay. Anybody have anything to talk about this?
Oh,
Just close this screen share.
okay. I don't know.
It's okay. If you look carefully, all whatever aphorism we are going through is very, what do we say, carefully distinguishing the diseases and types and even what is you call for similar diseases and what is dissimilar diseases. So he talks about Sora. He talks about venereal diseases. Yes, he talks
Yeah.
about syphilis. I prefer to use the word venereal and non-venereal instead of Sora and psychosis or syphilis.
Yeah.
Because when you talk about the word non-venereal, it means Sora. And it
Yeah.
also means it is not venereal.
Yeah.
And venereal, remember everybody? Venereal means sexually transmitted disease.
And when we use venereal, we can consider that word even whatever diseases we have nowadays. It's not just limited to psychosis or syphilis. Whatever diseases are transmitted sexually or sexual route can
Okay.
fall under that category. We have huge amount of totality of symptom of venereal origin.
Okay. So in case taking, we would ask, when asking about sexual function, then we would ask if they had any of these symptoms, if we wanted to know whether we
Exactly.
have seated, okay, syphilis or psychosis. Okay.
Yeah. And if you don't have, see, venereal disease history, patient might give not at the beginning, but non-venereal contact is quite likely to happen in very early in the lifespan.
Yes, yes.
Non-venereal, it is a contact, so it might
I think
get
I
the
even
contact.
I think I even remember reading the other day that Sora can be he didn't use the word transmitted but inherited from the mother. Is it possible I read that, or
There is
Yes.
see there is that word but see the concept is like that. We get that stigma from our parents,
yeah,
right? But whatever we get is not actually we call disease in this context,
okay,
because naturally you are sensitive. Your susceptibilities accordingly how your body is built, how
yeah,
it is made, how its organs are built,
yeah,
and they will function accordingly how they are.
okay,
So, but unless and until this individual get in contact with contagion in his life, then only
okay,
he will have the infection.
and
And then whatever the natural functions his body is having, according to his body build up, will alter. Right?
Yeah. According to susceptibility, yeah.
Yeah. And naturally, how he will react to that contagion, or how his body will function after that infection will be totally dependent of how his physical makeup is there, how his susceptibility is there, which
Okay.
he got from his parents.
Okay. I have another question. What about other sexually transmitted diseases such as chlamydia?
Yeah, you can consider. You can consider. Hahnemann has used word non-venereal. That's why I am very comfortable to use the word venereal. So I can consider any type of disease which we have nowadays.
Okay.
It's not just limited to psoriasis or psychosis. We have structure. Whenever there is accumulation or there is hardness or growths like tumors after sexual contagion,
Okay.
you can consider with
Okay.
psychosis,
Okay.
right?
Okay. Yeah. That's
Even
kind of the modern approach, but it's useful, yeah.
Just use word venereal, and you have symptoms. Either it will be hardness tumors, or either it will be destruction.
Okay.
for
Accordingly, it will be
example,
fall under that category.
you
The
know how
basic, yeah, take one.
I was just saying that you know how women get yeast infections,
Yeah.
vaginal infections. Those, it's helpful to treat the partner as well, because this can be something that just goes back and forth between the partner. It's
Exactly.
not technically, one of the sexually transmitted diseases according to Hahnemann's chronic diseases, but in our real life situation, we can see that when women get a lot of candida infections, that it can be helpful to treat the man as well.
But would you expect thuya in such cases, or no?
No, it's technically candida is a spora, but it
Oh.
can be passed back and forth between sexual partners.
Oh, okay. That's really interesting.
So whenever you have a woman who gets a candida infection, I don't mean, once every 4 years, but whenever, if you have some where it keeps coming back and keeps coming back, you might want to treat her sexual partner as well.
Okay. Interesting.
Okay, anybody else have
other
anything to
question,
say? Yes, anybody else?
sir? Chronic disease is very interesting topic. But we need to understand that the concept, how Hahnemann has put before us.
Yes.
And it's not what we call a disease of a chronic type, only like that. For myism, he used that word myism. And also, we know what is myism. Myism literally means a pollution.
Yes.
But it also
Huh?
literally means germs.
Yeah. And what is pollutant? What the pollutant can be? It can be anything. They are germs. It can be air. It can be water. It's not limited to germs.
But how far can you go with that? Can you living in a toxically, like psychologically toxic environment via
Yeah.
pollution.
That depends upon that susceptibility of the individual, how long he will do.
Yeah, but then in that case, it wouldn't be a pollution, it would be more of a maintaining cause.
Yes.
Exactly.
And, you know, things like pollution and stuff like that, I wouldn't classify that as chronic. I would call that more of a medicinal type disease because people are bombarded chronically with all
Exactly.
kinds of
That's why Hahnemann has not categorized this maintaining cause disease under dynamic disease.
What do you mean? I don't understand.
Because all the miasms, venereal or non-venereal, these are dynamic. These are caused by dynamic.
Yeah.
It's not a material microbe, or it's not. It's dynamic infection. It affects your dynamics.
Yeah.
It does not affect you physically, materialistic way.
Fundamentally not, but
Yeah.
yeah.
First, this dynamics is affected, and then the dynamics will change the physical state.
Yeah,
Material state.
Yeah.
So, a pollution or a maintaining cause, Hahnemann says, if the person is removed from that, or cause is removed from the person, many of the symptoms, almost 90% of the symptom will go off. And
That's
there will be a 10%.
That's a false chronic disease.
Yeah.
If when you remove the
And
main
10% which has been dynamically affected will need anti-miasmatic remedies,
Okay.
or basically a broad way you can say anti-sodic remedy.
Well, while we're on the topic of that, and since you say the numbers are so high, what would be most often maintaining causes we have today with people? Most common maintaining causes.
You can count any. There are a lot.
But could you give an example of a common maintaining cause?
Common maintaining cause.
Yeah.
I think it may vary from place to place, or country to country.
Okay.
We have a lot we can see here. As for example, we see somebody is living in a highly polluted metro.
Highly polluted what?
Metro cities.
Okay.
And a lot of people might suffer with skin or respiratory symptom. The workers working in cement factory.
Yeah.
Or worker working in thermal power station where power is generated from coal. Or people living beside that area in that town, they might widely suffer. Or you can count any. Pick one.
Or, you know, another maintaining cause might be, let's say, a lack of nutrition, or eating too much processed food.
Or you constantly eating the same type of food for years.
But at the same time, Hahnemann says that people can get well on bread and salt alone.
Yona? I think she lost.
Maybe, but we
Yeah.
still have the recording, so that's fine. She might have lost her internet. Okay, anybody else have anything else to say about this?
Dr. Sandhya?
Hello.
Yourself?
Okay. I'm too much confused. Nowadays, miasms is producing the different way, like accumulation or like each. So this is a theory is a right or wrong?
Wrong.
Wrong.
Basically, animals are classified only into two.
Yeah.
Either it is sexually transmitted, or which are not sexually transmitted, means venereal or non-venereal.
Okay.
So for venereal, there has to be a sexual contact,
Okay.
and for non-venereal, there has to be uh, a contact only or touch to a contagion, to a
Okay.
general skin. But venereal, he mentioned that the contact part should be rich in nerves and blood supply, a delicate structure of the body.
Okay.
And first primary manifestation of non-venereal will be seen on the genitals. But
Okay.
non-venereal, there it might be anywhere on the general skin. So what we have to do? We just have to look whether it can be sexually origin or non-sexual. So, and what nowadays being taught in homeopathic schools, Sora as a functional change, psychosis as accumulation, and
Syphilitic is a
destruction, right?
yeah.
But every disease begins with functional change.
Yeah.
It can be venereal or it can be non-venereal.
Yeah.
There is accumulation or there is a hardness in every disease, and there is destruction in every disease. So these three parts will be a stages of one disease.
Means Sora is also have a three part. One is a functional, second is a might be accumulation, and third is a destruction.
All three
miasms
will have these three functions.
But it is a wrong. We always called that Sora is a functional changes, syphilis is a destruction, and psychotic is a growth. This is a wrong theory.
Exactly.
Yeah,
Animal
because
has mentioned. Tikwa, do you remember that page in chronic disease?
yeah, I mean, there's everything. There's so many things that are spora. I mean, every kind of like wart or tumor that is like, anywhere other than sexually transmitted belongs to spora. So if somebody has like warts all over their hands, they have a problem with spora. If they have warts on their face, they have a problem with spora. If they have warts on their vulva, they have probably sexually transmitted warts. So
Yeah.
everything, whether or not something is an overgrowth or whether or not it is erosion or whether or not it's an eruption is irrelevant when we're learning Hahnemann's chronic diseases, because all these things can come underneath spora as well as psychosis and syphilis. But there are some very specific things for psychosis, and psychosis actually encompasses a couple of different ailments. It can be a urethral discharge and it can be genital warp. So he really has urethral discharge and urinary type problems, you know, which could be chlamydia, and it also can be gonorrhea, and that's in the psychosis. So, you know, it's just like the same thing with spora. There's a lot of different pathogens that will, you know, infect people to become spora. That can be staph, it can be strep, it can be herpes,
Okay.
and it can be fungus. All these things are under the category of spora. So if somebody has athlete foot or ringworm, we're looking at spora.
Okay.
Yeah.
So that's really, you know, pathogen theory and which pathogens would cause each type of illness, you know, is a newer development in science.
Okay.
And
One
Do
thing I want.
can you allow me to for screen share?
okay.
A minute.
We have to kind of take Hahnemann's chronic diseases and look at it with a bigger picture than what it just says with the words, because
This paragraph, the most painstaking observation.
Which number page, sir? This is about the current disease book.
Yeah.
Okay.
Can you read
The-
the
Yeah.
no, I can't see it from here.
Can I make
Most painstaking.
1 minute? Can you read now?
Nope, I still can't see it. You tell me
Why?
what page it's on. I have a better chance looking in my book.
I don't know this PDF, but 1 minute. 1 minute. I will check into a book.
Okay, this is before the symptoms of latent spora. You can tell me where it is in the book.
Did you find it?
I can if you just give me a few hints of where it is in the book.
Just a minute. Page number. Continuous repetition. Page number. Okay. Page number 7.
Okay.
Look. I don't know. Page number 7, the most painstaking observation as to aid efforted by antisoric remedies. He was analyzing those antisoric remedies. Means from all proving data he has. Means what symptom of sora are there, and he was making that difference, which were added in the first 11 years that have taught me ever more how frequently, not only, look at the word, not only the moderate, but also the most severe and more severe and most severe chronic disease are of this origin. He's talking about sora. This observation taught me that not only most of the all cutaneous eruptions which William Whelan distinguish with such extreme care from one another, and which received separate names, but also almost all adventitious formation. What is adventitious formation?
Growth.
Growth from from a common warts on the finger up to a largest sarcomatous tumor. What is this sarcomatous tumors means?
Means cancerous growth.
Huh?
Cancer?
Yeah.
Yeah. Sarcoma is a most dangerous cancer nowadays. And from malformation of a fingernail up to a swelling of bones, curvature of spine, and many other softening and deformities of the bone, both at early and at most advanced age, are caused by psora.
Yeah, we have a different list here on page 143 from the footnote. It thus unfolds into manifold forms of disease with so many varieties that they are by no means exhausted by the disease symptoms enumerated in the pathology of the old school, and erroneously designated. There are well defined, constant and peculiar diseases. They hear the following names: scrofola, rickets, spina ventosa, atrophy, marasmus, consumption, pulmonary consumption, that's tuberculosis, asthma, caves mucosa, laryngeal phthisis, chronic catarrh, constant coryza, difficult dentition, worms and consequent diseases, dyspepsia, abdomnia, cramps, hypochondria, hysteria, dropsy, dropsy of the abdomen, dropsy of the ovaries, of the uterus, hydrocele, hydrocephalus, amenorrhea, dysmenorrhea, uterine hemorrhages, hemotemesis, hemorrhages, vaginal hemorrhages, dysuria, exuria, enuresis, diabetes, catarrh of the bladder, nephralgia, gravel of the kidneys, stricture of the urethra, stricture of the intestines, blind and running piles, fistula of the rectum, difficult stools, constipation, chronic diarrhea, induration of the liver, jaundice, cyanosis, heart disease, palpitation, spasms of the chest, dropsy of the chest, miscarriage, sterility, metromania, impotence, induration of the testicles, dwindling of the testicles, prolapsed uterus, inversion of the uterus, all the different types of hernias, dislocations of the joint, from curvature of the spine, chronic inflammation of the eyes, short-sightedness, long-sightedness, deafness, glaucoma, cataract, tinea, tinea lacta, tetters, herpes, pimples, nettle rash, goiter, aneurysm, erysipelas, sarcomas, osteosarcoma, cancer of the lips, cheek, breast, uterus, rheumatism, gout, naughty gout, apoplectic fits, swoons, vertigo, contractions, epilepsy, etc. And of course, imbecility, insanity, melancholy, and nervous debility. These are all included in spora. So these are all types of chronic diseases that affect humans that have its origin in spora. And it's a huge list. The things that are not included are more important. Things like influenza or measles or chickenpox. These are things that are acute diseases that have no relationship to spora. They happen to everybody and anybody.
Unconditionally.
Yes.
Can I say something?
Yeah.
This Dr. Sandhya, what she has said, and what I understand in my way, that as far as Hahnemann's classification of the diseases, we say that the acute disease and the chronic disease.
Yeah.
Acute disease is separate. As far as chronic diseases are caused by miasm and some pseudo-chronic diseases. Let us separate pseudo-chronic disease. In chronic disease, it is caused by miasm. They are of two types. As Dr. Sanjay said, it is venereal and non-venereal. What in present days, the teachings which are going in India especially and some other part of the world, they have divided this sora in three parts. As pathology books, as far as what Robbins pathology says, there is a defense mechanism. As per the defense mechanism, they categorized this sora in three parts. That is primary, inflammatory, secondary, fortification or accumulation, and third, this second tertiary, that is destructive part. I think that they have categorized the sora into three parts: inflammation, fortification, secondary defense, and tertiary defense as a destruction. They have categorized this way: functional part or the accumulation part or synthesis part or deposition part. And in tertiary defense, they have taken the destructive part. But all this is under sora.
Exactly.
As far as venereal disease is concerned, that is totally different. Totally different. In that also, all these
we have this part.
three type of defense may come.
Yeah.
Three type of defense may come: means primary inflammation, secondary inflammation, or tertiary, or the destructive inflammation. This all can come in venereal disease also.
Yeah.
But as far as Hahnemann is concerned, as Dr. Sanjay said correctly, that there are two types of chronic disease: sora or non-venereal and venereal.
Yeah.
This non-venereal, for the sake of understanding in present day pathology or modern pathology types, they have categorized in this way. This is, I think. So when we are going to teach the new students as per pathology, and the pathology they read in first year or second year, they read pathology and they read then miasm, and they get confused. So for the sake of understanding, probably people have made this type of nomenclature. This is what I feel.
Yeah, you are right. Because but the problem is that.
But they are dividing this sora in three parts. That is wrong. They are saying only
miasm itself are causes of disease. Because
right,
he say its origin from that. Whether it can be a venereal origin, a sexual root, or it can be a non-venereal, a non-sexual.
Either.
So, yeah, it can be anything. But he says a big room for this non-venereal.
In present scenario, when they have categorized these three defense and saying they are sora, psychosis, and syphilis, I don't agree personally with them. The sora part also covers all the three types of defense: primary, secondary, and tertiary. And in
Yeah.
venereal also, all three types of defense are there: primary,
Yeah.
secondary, and tertiary.
When,
So if
when you consider one disease, it has all stages, all phases.
yeah, that is
Ah. And what we are looking at the origin from where it is beginning.
true.
So disease can be anything at any stage.
Right.
So if you have a non-venereal origin, then it is a
Mm.
sora. And more likely, sora is very infectious. It is very widely, easily.
It
Uh,
is right that
uh,
if we read syphilinum, in syphilinum there is a symptom that the corn of the syphilinum is as if of inverted cones, and
yeah.
this corn in present day they are saying that this is psychotic. Okay, fine. But syphilinum is the medicine. The source of the medicine is venereal part,
Yeah.
right? But it is covering again those soric features, which apparently or misnomally we are calling psychosis. But syphilis again in venereal part, they are having all these three features, whether it is cone or the primary inflammation or so. And say the sulfur covers the same. Sulfur is said to have antisoric medicine, but as these other people are they are saying that sulfur is the king of sora, but at the same time there are syphilitic features, or in their terms syphilitic features, but they are actually destructive features. They can cover venereal as well as non-venereal features both.
There is one disease or some type of disease as on genital. There is a itching on genitals,
Yeah,
and there is no history of sexual growth.
you're right.
So anything that goes on genital doesn't fall on the what we call venereal myxome.
Correct.
So similarly, we can see there is a itching cured by Merck salt.
Yeah,
And we have sulfur also.
correct.
When you are giving Merck salt for itching of genitals with non-venereal origin, definitely it will subside that itching part, but it will not cure. That sure will need anti-psoric remedy, which have very strong psoric part. And chronic disease, it is very clear. Look at the origin. Look at the totality.
True.
And it's not you get infection once in a lifetime. You are prone to get infection again and again. And every time it is altering the whatever structure susceptibility you have, either healthy state or disease state. When you get a fresh infection, that will alter and make whatever you have a more complex. It's very lengthy. We have a lot of time continuing this topic. Right, Tikman?
Yeah, we do.
And very interesting. Unless we understand disease, how you treat a person. But whatever we have studies in our academic structure in India, we have, it's really very wrong. study allopathic ways and we study homeopathic ways, and we make that very crazy soup.
We try to amalgamate
Yeah.
and fail.
That's right. Try to amalgamate and
And that's
fail.
And
how
fail.
people are more
Hmm.
confused in India.
Yeah, yeah.
And I'm really see the this Iona, these Western people, sorry, not European people, huh?
Hmm.
They don't have that background of allopathic structure, pathology, and everything, and they have very clear idea of what homeopathy is. They know
But
only
I
that
think they
part.
also study. But I think they all study the basic medicine or basic subjects of medical science first. Then they study homeopathy. I think that
No,
is the
no,
way
no,
of
no.
their learning.
In Europe, if you
Hmm.
have to practice, they have that structure for legally practicing.
Hmm.
But many people are not doctors.
Hmm.
People might know much better than me.
British or American or Canadian homeopaths are not medical doctors. They receive us, anatomy, physiology, things like that to understand how the human body works. But there isn't that depth of pathology or that kind of trying to inculcate an allopathic curriculum and then
Hmm.
put side by side the homeopathic curriculum. So it's just done in a different way.
Okay, that means education system in India is different than these parts.
Yeah.
Yeah.
For example, I don't carry the title doctor.
Hmm. Okay, you don't carry the title doctor.
No, I'm a homeopath. I'm not a doctor.
Hmm. But you are a medical doctor, whether homeopath or any other system. You are a medical doctor. I don't know. There may be some differences in country to country, but we study all the subjects
Yeah.
almost
But
except
homeopath,
pharmacology. Hmm.
homeopath only in India, homeopaths are labeled as doctor.
Hmm. As far as pharmacology is concerned, we don't study pharmacology. Otherwise, almost all the subjects we study. We study all the subjects what allopathic student is studying, MBBS student is studying. Beside that, we study homeopathic subjects also. Organon, pharmacy, anthropatry, and philosophy, and so and so. So in India,
Pharmacology.
homeopathic students study more than the MBBS student.
Yeah. We have more, but
Yeah.
we don't have time.
Mhm. Anyway, it's a good discussion.
Was materia medica is pharmacology. If we read so before the
It is
materia medica is
in homeopathy we have materia medica, but in
huh.
MBBS curriculum there is pharmacology.
Now
The name is different.
no, they change the term only. They
Mhm.
change the term. Now materia they also use the before materia medica, but nowadays they change the term is the pharmacology. But the VR is in the same form, materia medica. It is a little bit different our pharmacology or their pharmacology because we
Yeah.
believe
Right,
on the
right.
dynamic action. They believe on the pharmacokinetic action, pharmacodynamic. They
Materia
believe on the
patterns.
absorption.
Mhm.
Okay,
Right.
guys. I think we can conclude here today's part. If there is nothing to say, people. What do you say?
Right.
Yeah, sounds good. Two dissimilar diseases they just occupy different parts of the body when they occur at the same time. And you treat them consecutively.
Right.
And join us again next time.
Right. Till then, bye-bye.